Are Xanax and Buspar the same? No, Xanax and Buspar are not the same medication. Although they are both used to treat anxiety disorders, they belong to different drug classes and have distinct mechanisms of action. Xanax is the brand name for the generic drug alprazolam, which is a benzodiazepine. Benzodiazepines work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain. This leads to a calming and sedating effect, making Xanax an effective short-term treatment for anxiety and panic disorders. However, due to its potential for abuse and addiction, Xanax is classified as a controlled substance and should be used with caution. On the other hand, Buspar is the brand name for the generic drug buspirone, which belongs to a class of medications known as azapirones. Unlike Xanax, Buspar does not act on GABA receptors. Instead, it works by affecting serotonin receptors in the brain, specifically the 5-HT1A receptor subtype. By modulating serotonin activity, Buspar helps reduce anxiety symptoms without causing sedation or the risk of dependency. It is often prescribed as a long-term treatment for generalized anxiety disorder. To better understand the difference between Xanax and Buspar, let's look at some examples. Example 1. If a person is experiencing a sudden onset of severe anxiety or a panic attack, a healthcare provider may prescribe Xanax to provide immediate relief. Xanax's fast-acting sedative properties can help calm the individual down and alleviate their symptoms quickly. Example 2. On the other hand, if someone is dealing with persistent, chronic anxiety that requires ongoing management, a healthcare provider may opt to prescribe Buspar. Buspar's mechanism of action allows for long-term anxiety relief without the risk of sedation or addiction. It is important to note that both Xanax and Buspar should only be taken under the guidance and prescription of a qualified healthcare professional. They should not be used interchangeably or without proper medical supervision, as misuse or incorrect dosage can lead to adverse effects or reduced efficacy.